organic material. They have essential metabolic functions required in very small amount in diet and cannot be synthesized by the body. There is one exception, that is vitamin D, which is synthesized in our body. Okay. But it is the general definition of vitamins. Now, the classification, we all know that is there is fat soluble vitamins and water soluble vitamins. Fat soluble vitamins are A, D, E, K, and water soluble vitamins are vitamin B complex and vitamin C. Now, today's topic is vitamin A. It is fat soluble vitamin. There are different compounds like retinol, retinal, retinoic acid and beta-carotenes. Okay. These 4 compounds are included in this vitamin A. Look at this retinol, it is the alcohol variety, retinal, aldehyde variety, retinoic acid, okay. These 3 forms the retinoids and this is beta-carotenes. Now, all compounds with vitamin A activity are referred to as retinoids. All compounds with vitamin A activity are referred to as retinoids. Which is these compounds? These are retinol, retinal, retinoic acid and beta-carotenes. Now, the dietary source of vitamin A, retinyl esters and the retinol are found in certain animal tissue. Okay. So, this retinyl ester and the retinol are animal tissue origin and these beta-carotenes are found in certain plants, okay, and the other carotenoids, they are found in certain plants. Now, the animal source, what are the animal source of vitamin A? Milk, butter, cream, cheese, egg yolk, liver, fish liver oil, cod liver oil, shark liver oil, okay. These are the fish liver oil which contains these retinoids or vitamin A. Now, the vegetable source, yellow pigment beta-carotene found in carrot, papaya, mango, pumpkin, all are yellow color vegetables and fruits, okay. Carrot, papaya, mango, pumpkin and green leafy vegetable like spinach. These are the vegetable source of vitamin A. Now, the transport of vitamin A. Dietary retinol is transported as retinyl ester. So, in blood there is retinyl ester in, okay, and transported as retinyl ester in chylomicron, okay. Chylomicron is the dietary fat, okay, chylomicron, okay. Dietary retinol is transported as retinyl ester in chylomicrons. Retinol is secreted by liver in association with plasma retinol binding protein, okay. So, it is secreted by the liver and it is associated with retinol binding protein, okay. So, retinol and it combines with retinol binding protein, okay. Now, the storage form, retinol is stored as retinyl esters mainly in the liver as retinol palmitate. So, storage form is retinol palmitate, it is the retinyl esters and it is mainly stored in liver and also in adipose tissue, okay. So, the storage form of vitamin A is retinol palmitate, the ester form. Now, the uptake by tissues, retinol and retinol binding protein complex binds to specific receptors. So, in blood retinol is always binds with retinol binding protein and it is binds to specific receptors on the retina, skin, gonads and the other tissues. There is uptake of this retinol in which tissues? The retina, skin, gonads and the other tissues. Retinol is oxidized to retinoic acid. It is the alcohol form and it is the acid form. So, it is oxidized to retinoic acid. Retinoic acid binds with retinoic acid receptors, retinoic acid receptors, RARs. Okay. This retinoic acid, retinol binds with retinol binding protein and the retinoic acid binds with retinoic acid receptors, okay, present in the nucleus of target tissues such as epithelial cells. Okay. The nucleus of the target tissue like epithelial cells contain this receptor. What is the receptor? The retinoic acid receptor. It binds with that retinoic acid. The activated RAR complex, retinoic acid and retinoic acid receptor complex, it is firstly activated. Then this activated complex binds to hormone response element on DNA. Okay. Look, that is the retinoic acid receptor present on the nucleus and it binds with this retinoic acid, then it is activated and the activated RAR complex binds with the hormone response element present on the DNA. Okay. DNA is within the nucleus and recruits activators or repressors to target to regulate retinoid specific RNA synthesis. That is, RNA synthesis means transcription and control specific protein synthesis, that is translation process. So, this retinol firstly oxidized to retinoic acid, then it is combined with the retinoic acid receptor, then it is activated, then this activated complex combines with hormone response element on the DNA and it regulates the transcription and the translation process, okay, and that mediate cellular differentiation. So, it is the mechanism of action of vitamin A. How it acts? Firstly, retinol, it binds with the retinol binding protein, transported and it is goes to specific tissues and it is oxidized, firstly oxidized to retinoic acid. It combines with the retinoic acid receptor, forms the RAR complex. This complex firstly activated. Then this activated complex binds with hormone response element present on the DNA and this there is activation of transcription of specific gene. After transcription there is production of mRNA, okay. Through transcription process there is production of mRNA and this mRNA produce specific proteins by translation process and this mediate cellular differentiation or the biological activity which vitamin A produce in different tissues, okay. Now, the biochemical role of vitamin A. Firstly, world's visual cycle. We all know that vitamin A helps in vision. How it acts? World's visual cycle, vitamin A is a component of visual pigment rhodopsin, okay, visual pigment rhodopsin and the vitamin A is a component of this rhodopsin. Rhodopsin is a membrane protein found in photoreceptor cells of retina. Photoreceptor cells of retina in eye, there is a pigment protein which is called rhodopsin. It is made up of vitamin A. Now this is the world's visual cycle. What happens in dark photoreceptors in the retina? There is formation of rhodopsin. Rhodopsin made up of vitamin A, which form 11-cis retinal, and the opsin protein, it is the protein part, and it is the vitamin A variant, 11-cis retinal, both combines and form rhodopsin, which is the visual pigment. It happens in dark, okay. In light, there is photoisomerization or visual excitation. So in light there is photoisomerization. So this 11-cis retinal and the opsin, which forms this rhodopsin, it breaks and the opsin is released, which again goes to this rhodopsin formation in dark. And the 11-cis retinal, it produces all trans retinal. There is photoisomerization, cis retinal to trans retinal. This it happens in retinal epithelium, and this all trans retinal goes to, through blood, it goes to liver, where dehydrogenase enzyme, dehydrogenase means NADH is required, and there is dehydrogenation and form the reduced form transretinol, retinal to retinol, okay. It happens in liver. This transretinol again by retinol isomerase, so transform, convert to cis form, cis retinol. This cis retinol again produce retinal, cis retinal. Here again dehydrogenase enzyme is required, here NAD plus is required and produce NADH. It also happens in liver. This cis retinal through blood, it goes to retinal epithelium, and in dark it again combines with opsin and produce this rhodopsin. This cycle is the world's visual cycle, okay. World's according to his name, okay. This cycle is named. Now the dark adaptation mechanism. In bright light, the rhodopsin store of the rods depletes. Here look at this. In bright light there is photoisomerization. So the rhodopsin breaks and forms all trans retinal and opsin. So the rhodopsin store, which is the visual pigment, is depletes in dark, in bright light, okay. Rods, store of the rods are depletes. In dark, after few minutes, rhodopsin is again resynthesized and vision is improved. So in case of bright light, there is reduction of rhodopsin, which is the visual pigment, and again after few minutes or few seconds, there is again regeneration. In dark there is regeneration of this rhodopsin, and this delay, this time interval is called the dark adaptation time. It is increased in vitamin A deficiency. So if there is vitamin A deficiency, so this 11-cis retinal is deficient, okay. So this 11-cis retinal will be deficient in vitamin A deficiency. So the rhodopsin store, which in dark again resynthesize rhodopsin, but in case of vitamin A deficiency, these require more time or there is delay. So the dark adaptation time will be increased in vitamin A deficiency. In case of when you enter the cinema hall or in night, when you switch off the bright light and switch on the night lamp, at first you notice nothing, but after few times there is rhodopsin is regenerated and The things will be in cinema hall also. You can notice the surrounding things. Okay, this is due to the dark adaptation time. Okay, and this is due to this rhodopsin depletion in bright light, and in dark light there is again regeneration of the rhodopsin. Now, red light bleaches the rhodopsin to a lesser extent. So, doctors use these tinted glasses during fluoroscopic X-ray examination of the patient. Okay, this red light bleaches the rhodopsin to lesser extent. Okay. Now, rods are for vision in dim light and cones for bright light. Rod cells and cone cells, you all know that. Okay. So, rods are for vision in dim light. In retina, two types of photosensitive cells, rods and cones. Rhodopsins present in rods is made up of 11-cis retinal and opsin. Deficiency of 11-cis retinal increases the dark adaptation time and night blindness. So, it is also called the night blindness. If there is vitamin A deficiency, so the rhodopsin will not generate and produce night blindness, okay, and increase the dark adaptation time. Now, the cones are for color vision, vision in bright light. They contain photosensitive protein conopsin. In case of rhodopsin, there is protein is opsin protein. In case of conopsin, there is in case of cones, there is the protein is conopsin. In rods, that is opsin. Okay. Now, there are three types of cones sensitive to blue, green and red colors. Okay. To check the color vision is okay or not, we tested this blue, green and red color, okay, in patients. In cone proteins also 11-cis retinal is the chromophore. So, 11-cis retinal present in both rods and cones, but the protein is changed. Here in cones there is conopsin, in rods there is opsin. Reduction in the number of cones or cone proteins will lead to color blindness. Okay. Now, the color have profound influence in life. 70% of the information input in brain are visual. Okay. 70% of the information input in brain is visual. Red light signifies optimist and active. Blue light sad mood. Okay. Green light least active, and the saffron light signifies tranquilizing, calm, relaxing. So, yogi or sannyasis wear the saffron color, okay, tranquilizing effect, calm and relaxing. Green represents least active, bright, sad mood, blue color sad mood, and red light optimist and active, okay. Now, the effects of color on human moods have applications in psychiatry, interior decorator and yoga, okay. This color is used. Now, the other biochemical functions of vitamin A. Retinoic acid has a role in regulation of gene expression and differentiation of the tissues, act like steroid hormone. The mechanism of this retinoic acid or the vitamin A variant retinoic acid have the similar type of action like steroid hormone. It also combines on the receptor of the nucleus, enters into the nucleus, then combined with the hormone response element, okay, then produce the differentiation and gene expression, effect on the gene expression and the differentiation of the tissues, okay. So, retinoic acid has a role in regulation of gene expression and differentiation of tissues. In reproduction, vitamin E deficiency cause miscarriage, okay. Anti-cancer activity due to natural antioxidant property of the carotenoids. So, carotenoids have anti-cancer property because these are natural antioxidant, maintenance of normal skin and epithelium. Now, the deficiency manifestations of vitamin A. Night blindness or nyctalopia. Okay. Visual acuity decreases at dim light due to decrease in the rhodopsin store. Okay. Rhodopsin cannot resynthesize due to deficiency of the vitamin A or 11-cis retinal. So, there is increased dark adaptation time. Okay. So, night blindness or nyctalopia. Next, xerophthalmia. Xerophthalmia is conjunctiva becomes dry, thick, wrinkled. Conjunctiva gets keratinized and loses its normal transparency. Dryness spreads to cornea. Firstly, conjunctiva becomes thick, dry, wrinkled, keratinized, then it passes spread to cornea, and cornea becomes glazy and lusterless due to keratinization of the corneal epithelium, and infection may supersedes. Okay. Next is, these are sequential. So, firstly develop patient in early case of vitamin A deficiency, first they develop night blindness. Okay. Then he develops xerophthalmia if not treated. Then develops bitot spot. What is bitot spot? Grayish white triangular plaque firmly adherent to the conjunctiva outer side due to increased thickness of the conjunctiva in certain areas, reversible when vitamin A supplemented. So, up to this stage, that means nyctalopia or night blindness, xerophthalmia and this bitot spot, up to this stage vitamin A deficiency is reversible. So, if you give adequate dose of vitamin A, then patient will recover. But after that, so up to bitot spot stage, you not treated the patient or can't identify the cause. So, not treated patient, if patient is not treated, then this is the bitot spot at the outer side of the eye. Okay. This is the cornea, it is the outer side, there is triangular plaque formation, grey white color. This is the bitot spot. It is always at the outer side of the cornea, okay, outer side of the eye. Now, next, after that bitot spot, this stage is keratomalacia. From this stage, it is not reversible. So, patient goes towards the complete blindness. Okay, keratomalacia, xerophthalmia for long time progress to keratomalacia, softening of the cornea, degeneration of the corneal epithelium which may get vascularized. So, cornea now get vascularized and later corneal opacity. If cornea is vascularized, so there is no transparency. So, corneal opacity will develop, bacterial infection leads to corneal ulceration, then it can progress to perforation and total blindness. Now, this is the keratomalacia. Cornea firstly become softening of the cornea, then it is vascularized, ultimately ulceration, perforation and complete blindness. Now, skin and mucous membrane lesions. Vitamin A acts in skin and epithelium also. So, if vitamin A is deficient, there is follicular hyperkeratosis or phrynoderma. Toad, এই ব্যাঙের মতো স্কিন, ব্যাঙের ইংরেজি কি? টোড তো, হ্যাঁ, টোড লাইক স্কিন। ওকে, follicular hyperkeratosis or phrynoderma, keratinizing metaplasia of epithelium of respiratory, GI, genitourinary tract. Okay, keratinizing metaplasia means there is a change in the epithelium. Okay, and effects on the infection. So it is called in past as anti-inflammatory vitamin. Vitamin A is also called as anti-inflammatory vitamin because it has effects on infections. Okay. Different use of vitamin A, retinol and its carotenoids. Carotenoid precursors are used as dietary supplement. Okay. In case of vitamin A deficiency, or carotenoid we use as anti-cancer or antioxidant drug, E carotene. Okay. Retinol is also used as dietary supplements. Retinoic acid are used in dermatology, skin. Retinoic acid are also used in skin. Isotretinoin, a synthetic variant of vitamin A, decreased sebaceous secretions, hence used in prevent acne formation during adolescence. In adolescent period, there is in some patients there is increased sebaceous secretion, okay, and acne formation. This is reduced by use of this isotretinoin or the synthetic variant of the vitamin A. Now, severe cystic acne unresponsive to treatment, the drug of choice is isotretinoin, which is 13-cis retinoic acid. It gives orally. Okay. Tretinoin is too toxic for systemic administration. This tretinoin is too toxic for systemic administration and is confined to topical application only. Okay. Absolutely contraindicated in a woman of childbearing age group. If we provide the orally administered drug, but it is absolutely contraindicated in during the childbearing age group because of the teratogenicity. This vitamin A or isotretinoin has teratogenic effect, so don't use it in childbearing age group woman. Now the normal level is 25 to 50 milligram per dl. Recommended daily allowance RDA in case of children 400 to 600 microgram per day. In case of 1 IU equal to 0.3 microgram of retinol. Okay. Now men, in case of men 750 to 1000, women 750 microgram per day, and in pregnancy 1000 microgram per day. Okay. This is the recommended daily allowance. Normal blood level 25 to 50 milligram per dl, and these are microgram per day. Okay. Now the vitamin A toxicity, hypervitaminosis. What is hypervitaminosis? The same means the vitamin is in excess in blood. Okay. So hypervitaminosis symptoms include anorexia, irritability, headache, peeling of skin, drowsiness and vomiting. Increased intracranial pressure mimics brain tumor. So these are the hypervitaminosis A symptoms: anorexia, irritability, headache, peeling of skin, drowsiness, vomiting, increased intracranial pressure which mimics brain tumor. Now hypercarotenemia, there is persistent excessive consumption of food rich in carotenoids. Food rich in carotenoids are papaya, carrot, pumpkin. Okay, these are food rich in carotenoids. So persistent excessive consumption of this food rich in carotenoids produce hypercarotenemia. The skin becomes yellow, but no staining of the sclera, and as in jaundice patient. Okay, so if the patient comes, skin is yellow, so you firstly think about the jaundice, but how it differentiate hyperkeratonemia with jaundice. Jaundice patient, in case of jaundice patient, we see the jaundice first in sclera, the upper part of the eye, okay, upper part of the cornea in the, okay, this is the sclera portion. So sclera is yellow color in case of jaundice patient, but in case of hyperkeratonemia, all body will be yellow, but the sclera will be white. Okay. So this is the differentiation between the jaundice patient and the hyperkeratonemia. Then you will take the history and you notice that there is excessive intake of the carotenoids. Now toxicity of the retinoids, teratogenesis. Excessive intake in pregnant woman cause teratogenesis, causing congenital malformation in the developing fetus. This is called teratogenesis, means congenital malformation in the developing fetus. Prolonged treatment can cause hyperlipidemia. Prolonged treatment with vitamin A or retinoids produce hyperlipidemia, increase triacylglycerol, increase cholesterol, increase risk of cardiovascular disease. Hyperlipidemia which produce increased risk of cardiovascular disease. Okay. So prolonged treatment with vitamin A produce cardiovascular disease. Okay, up to this. So in case of vitamin A, these are the retinoids. Okay. Dietary source and the you have to remember the transport form. It can be given in MCQ, retinol palmitate. Now, how it acts like steroid hormone by this RARR complex, and there is activated RARR complex and which binds to the hormone response element. There is activation of the specific gene transcription, then mRNA formation, specific protein synthesis and cellular differentiation. Now this world visual cycle, okay. Rhodopsin is the visual pigment. In bright light there is breakdown of this rhodopsin, forms all-trans retinal which goes to liver, forms retinol, cis-retinol, it again cis-retinol to cis-retinal, it goes to retinal epithelium, and where in dark light or dim light there is production of this rhodopsin again. If there is vitamin A deficiency, there is increased dark adaptation time or night blindness. Okay. Now the biochemical role of the vitamin A, steroid-like function in cellular differentiation, okay, anti-cancer, carotenoids, normal integrity of the skin and the epithelium. Then the deficiency manifestations according to these serial orders: firstly night blindness, then xerophthalmia, then bitter spot, okay, then keratomalacia. From this stage it is irreversible, okay, and ultimately goes to night blindness, to complete blindness. And these are the skin and mucous membrane lesions due to vitamin A deficiency. Follicular hyperkeratosis or phrenoderma, keratinizing metaplasia of the epithelium of different tissues, respiratory, GI, genitourinary tract. There is infection, increased infection chance, okay. And these are the uses of vitamin A as dietary supplement in case of dermatology, okay, in case of acne formation, okay, these are the use. And this is the vitamin A toxicity and hyperkeratonemia, okay. This is the vitamin A, okay. Thank you. The fat soluble vitamin, okay. Chemical name tocopherols, okay, with isoprenoid side chain, okay. So tocopherols or the vitamin A has one side chain which is called isoprenoid side chain. There are 8 variants of these tocopherols, of which alpha tocopherol has greatest biological activity, alpha tocopherol. Okay. Recommended daily allowance is 10 milligram per day, 10 milligram per day. Source vegetable oil. Okay. The biological role of vitamin E, most powerful natural antioxidant. So vitamin E is the most powerful natural antioxidant. Free radicals attack the biomembrane and the vitamin E quench the lipid peroxidation chain and protect the plasma membrane, okay, from this free radical attack. You have heard the glutathione peroxidase and the reduced glutathione in case of this free radical scavenging process. It is another example. Vitamin E, it quench the lipid peroxidation chain and protect the plasma membrane, okay, from free radical attacks, and they protect RBC from hemolysis, okay. This is another example of this, how body protect the RBC from the hemolysis, okay. Now boost immune systems and acts as anti-aging. How it acts? Because it protect the free radical attack, okay. So it use as anti-aging. Natural antioxidant boost the immune system and acts like anti-aging and protect the body from free radical injury by breaking the lipid peroxidation chain, okay. Now the interrelationship with selenium, it acts with selenium synergistically. Selenium is present in glutathione peroxidase, an important enzyme that oxidizes and destroys the free radicals. You have answered in your theory copy very well, okay. This glutathione peroxidase, okay. Now vitamin E and selenium acts synergistically to minimize this lipid peroxidation, okay. Now the deficiency of vitamin E, anti-infertility vitamin, okay. It is, vitamin E is anti-infertility vitamin. So in case of deficiency of vitamin E, there is infertility, okay. In case of vitamin A deficiency, which produce miscarriage, here it produces infertility. So deficiency cause infertility, hemolysis, acute hepatic necrosis, muscular dystrophy, hemolytic anemia and testicular atrophy. These are the deficiency manifestations of vitamin E. What are those? Infertility, hemolysis, acute hepatic necrosis, muscular dystrophy, hemolytic anemia, testicular atrophy. Found in fat malabsorption, cystic fibrosis, chronic liver disease, premature infant. So in these patients also found that vitamin E is deficient, where now fat malabsorption, cystic fibrosis, chronic liver disease, premature infant, there is vitamin E is deficient. So this is the vitamin E, okay. You need up to this for vitamin E, okay. Main function is antioxidant and free radical injury, okay. Next, another vitamin, fat soluble vitamin is vitamin K, ADEK, okay. So types: phyloquinone, found in green leafy vegetables; menaquinone, found in intestinal bacteria. It produces this menaquinone variety. Menadione, it is the synthetic compound of vitamin K, metabolized to phyloquinone more than the menaquinone. So in body there is phyloquinone, which found in green leafy vegetables, and menaquinone found in intestinal bacteria. It produces this menaquinone. Another synthetic variety is menadione, which in body metabolized to phyloquinone more than the menaquinone. Recommended daily allowance is 55 to 65 microgram per day. Biological role, coenzyme for carboxylation reaction of glutamate in post-synthetic modification of calcium binding proteins to form gamma carboxylation. In case of blood coagulation, we found these reactions. Okay, this is the so vitamin K acts as coenzyme for which reaction? The carboxylation reaction. Carboxylation of what? The glutamate. In post-synthetic, after synthesis of this glutamate, there is modification of the calcium binding proteins to form gamma carboxylation. So, gamma carboxylation of this glutamic acid or glutamate. This reaction is mediated by this or coenzyme which is vitamin K. It is important for synthesis of bone and other calcium binding proteins. Okay, it is important for synthesis of bone and other calcium binding proteins. Vitamin K dependent factors in coagulation cascades. What are the vitamin K dependent factor? 2, 7, 9, 10. Factor 2, factor 7, factor 9 and factor 10. Factor 2 is called prothrombin. 7, SPCA. Factor 10, Christmas factor, and factor 10, 9 is Christmas factor and 10 is Stewart power factor. You have to remember this prothrombin, factor 2 is prothrombin. And you can write this factor 2, 7, 9, 10. These are the vitamin K dependent factors of coagulation. Okay. They synthesize in liver as inactive zymogen. Enzyme in inactive form is called zymogen. Okay. So, these factors synthesized in the liver but in the inactive form, that is inactive zymogen. Vitamin K acts as cofactor, helps in post-translational modification. In translation process, there is production of protein. Okay. So, protein synthesis is called translation. So, these proteins are synthesized but these are inactive form, zymogen, inactive zymogen. And vitamin K acts as cofactor and helps in post-translational modification of these proteins and forms the active form of these proteins. Okay. Vitamin K dependent carboxylase. Mycosomal vitamin K dependent carboxylases, mycosomal enzymes requires oxygen, CO2, NADPH, reduced vitamin K. Okay, this reaction, carboxylation reaction require O2, CO2, NADPH and reduced vitamin K. Vitamin K acts as cofactor in gamma carboxyglutamic acid synthesis. In previous slide, there is this post-translational modification of this glutamate is mediated by vitamin K which acts as coenzyme. Okay. So, vitamin K acts as cofactor in gamma carboxyglutamic acid synthesis. Okay. This process is competitively inhibited by warfarin and decomaril. Okay. These are the drugs used in case of these two drugs competitively inhibit this process. So, this process means this carboxylation, gamma carboxyglutamic acid synthesis. This is mediated by the cofactor vitamin K, and this process is inhibited by these two drugs warfarin and the decomaril. Okay. Now, causes of vitamin K deficiency: malabsorption of lipid. If lipid is malabsorbed, so there is malabsorption of lipid means lipid is reduced in body. So, the fat soluble vitamins are also reduced. So, vitamin K is deficient. Prolonged antibiotic therapy, because the menaquinone form is produced by these antibiotics, bacteria. So, if there is prolonged antibiotic therapy, there is vitamin K deficiency, and GI infections with diarrhea also produce there is reduction of the synthesis of this variant which is generated by the organisms. Okay. So, this will be reduced. Now, the clinical manifestations of this vitamin K deficiency. Coagulation process will be hampered. So, there is hemorrhagic disease of newborn due to deficiency of this activated form of 2, 7, 9, 10 coagulation factors. So, there is hemorrhagic disease of newborn, especially the premature infants due to lack of hepatic stores and low oral intake of the as breast milk has very low level of vitamin K and low intestinal flora. So, in case of premature infant, there is intestinal flora is reduced and the breast milk is also reduced in vitamin K, and there is low oral intake and lack of hepatic store. All these produce the hemorrhagic disease of newborn due to deficiency of this vitamin K, manifested as bruising tendency, ecchymotic patches. Ecchymotic patches means reddish blue type patches on the skin. Okay. Bruising tendency means bruising is one type of injury. Okay. You will learn this in FSM classes. Okay. And mucous membrane hemorrhage, post traumatic bleeding, nasal bleeding and internal bleeding. So, there is increased tendency of overall bleeding due to deficiency of this vitamin K. Lab finding of vitamin K deficiency, prolonged prothrombin time. Due to lack of this prothrombin, vitamin K deficiency produce prolonged prothrombin time, delayed clotting time. Prothrombin time as index of the liver function. PT is the liver function index, okay, prothrombin time, and prolonged PT is due to deficient synthesis of the coagulation factors. Okay, vitamin K deficiency produce deficiency of the activated form of vitamin factor 2, 7, 9, 10. So, there is bleeding tendency, and lab finding of vitamin K deficiency is there is increased prothrombin time, delayed clotting time. Okay. And so, jaundice patient also there is jaundice patient for liver surgery, we need vitamin K injection. So, in case of jaundice patient, if there is liver surgery we needed, so or any patient where prothrombin time is increased or delayed clotting time, we have to inject vitamin K injection. Okay. In case of this patient, vitamin K deficiency patient, which goes for surgery. In surgery there is increased chance of bleeding. So, to protect that we have given vitamin K injections prior to the OT 3 days prior. Okay. Now, another term, fetal Warfarin syndrome. Warfarin and documorol will competitively inhibit the gamma carboxylation of glutamic acid due to structural similarity of vitamin K. Hence, they are widely used as anticoagulants for therapeutic purpose. Anticoagulant, vitamin K helps in coagulation by activating the factors, okay, coagulation factors. So, these two drugs, warfarin and documorol, due to they competitively inhibit means they have structural similarity of vitamin K and competitively inhibit this vitamin K. So, they are used as anticoagulant, okay, anticoagulant for therapeutic purposes. Treatment of pregnant woman with warfarin can lead to fetal bone abnormalities or fetal warfarin syndrome. Okay. Treatment of pregnant woman with warfarin produce anticoagulation, okay, and can lead to fetal bone abnormalities or fetal warfarin syndrome. It is related to this vitamin K. Now, another term, hypervitaminosis K produce hemolysis, hyperbilirubinemia, kernicterus, brain damage are the toxic manifestations and need to keep in mind during treating the premature babies. Okay, so pregnant women who are treated with this warfarin and documorol have chance to fetal warfarin syndrome in babies. Okay, and vitamin So this is not due to hypervitaminosis K. Hypervitaminosis means increased vitamin K, and these are the in case of premature babies, if we overtreat, then we will produce the hypervitaminosis K. But if in case of premature babies, there is hypovitaminosis. Okay, vitamin K is deficient, which produce this hemolysis and other bleeding manifestations and toxic manifestations if we overtreat the patient. Okay, then there will be hypervitaminosis K. So up to this is vitamin K. In vitamin K, you have to remember the factors which are activated by this vitamin K. Okay, factor 2, 7, 9, 10. Okay, and the forms of vitamin K